Yes,
actually, one of the things, yeah. So one of the things, aside from the ending of or trying to lift the lockdowns, we also want to advocate what we call the early treatment protocols. No, so early treatment meaning you don't wait for the person who is infected with COVID to be sick enough to go to the hospital. So you treat them as early as possible. So when is as early? The moment you have symptoms, okay? While you're still awaiting for the results of your test, your COVID test, you already start treating the patient. So that if in case the patient is positive, you already have that protection. You're already giving them treatments even before you get the results of COVID, because most of a lot, sadly, some of the test comes out 3 to 4 days, especially for those who are over 65. Those 3 days are the golden period. You miss that opportunity to treat them, they're going to be worse off, and they're going to be ending up. So personally, I've
and
treated
what
over
would be the treatment? What
the
would the treatment entail?
Yes.
Yeah, the treatment
You mentioned
entails.
some vitamins. You mentioned some vitamins.
Yeah. So that for okay. So in sa basic, for those who are, let's say, they're elderly or they have what we call risk factors or comorbidity, we start them on vitamin C, at least 3,000 milligrams a day, vitamin D 5,000 units a day, and then some zinc. That's why a lot of vitamins now with zinc are always out of stock. 50 milligrams a day, and then you have what we call the quercetin. Quercetin is it's a phytochemical that works well with zinc in preventing the COVID virus or the SARS-CoV virus from penetrating your body. So these are what we call immune boosting supplements. Okay.
Like
so
what?
now,
Like
however, yes.
like what? Like what? What supplements? Virgin coconut oil, pwede ba yan? Because
virgin coconut oil, you can use that. Yes, you can also use that as a form of to boost your immune system to prevent.
Lagundi.
BCO also has some antiviral properties, no?
Yeah.
But however, for treatment, for treatment of COVID infections, this is where the controversy lies again, because Trump has mentioned hydroxychloroquine, but aside from hydroxychloroquine, there's also ivermectin. So hydroxychloroquine and ivermectin have been shown when used early, when used early outpatient, meaning they're not in the hospital, they're at home or in a facility, you treat them, the risk of being hospitalized or dying is almost at least 80%, and there is data. I mean, a lot of doctors keep on saying there's no data. We've shown that hydroxychloroquine doesn't work. But if you really look at the data, if they really go through all the data, they will see that there is a positive effect of these antiviral medications. So, in fact, there's already in the United States, there's already been 2 Senate hearings on early outpatient treatment for COVID infection. So I think that's now the most important step aside from lifting the lockdown is we advocate early treatment. So IATF been saying we do test, we do trace, and then we isolate or quarantine. How about early treatment? If they're in the isolation or in the hospital, they have symptoms, shouldn't you at least start them on some form of antibiotics to prevent them to having a more serious disease? I think that's common sense. That's basic medical science. That's what we do. If you get a cold or cough, you take medicine because you don't want to get worse. The same thing. So why do you have to wait for the COVID virus to make you so sick that you have to go to the hospital? So I think we have to change our way of thinking with regards to treating COVID infections.